Good afternoon, ladies and gentlemen. My name is Oscar Spalter. I am a general practitioner with a postgraduate degree in cardiology. I am from Montevideo, Uruguay, in South America. Here. Firstly, I would like to start by telling you that I am really honored to have been selected by the committee and to let me share with you my professional experience regarding the change in the lifestyle of my patients. Secondly, I would like you to be patient with my English. My English isn't American English, nor is it British, and needless to say, it is not Australian English. My English is Uruguayan English, and in Uruguay, we speak Spanish. But I can assure you, I am making a great effort so that you can understand me. Well, while I was studying to be a cardiologist, I observed that most of the patients I assisted were those who suffered a coronary artery disease. Some of them had acute cardiovascular events like acute myocardial infarction and stroke. Others were diagnosed with coronary artery disease, but didn't get to the point of a heart attack because measures were taken promptly through a coronary revascularization procedure, either with coronary catheterization, angioplasty, and stent implantation, or myocardial revascularization surgery. All these patients were prescribed a plan called secondary prevention, which means that the patient has to make a strict, sudden, and aggressive change in the lifestyle together with medication. This is due to the fact that patients who have suffered a coronary event have 30% more probability of having another coronary event than another person with the same characteristics but who hasn't had such coronary event. Therefore, I wondered, why does a person need to be ill in order to change their lifestyle? Why does a person need to be obliged in order to do so? Why not anticipate it? Why not anticipate it and do it while being healthy and willingly? These conceptual questions weighed heavily on my mind, but laboratories and their pursuit of wealth by selling medication obscured my thoughts. It was at that stage that I started doing research about the real cause, the underlying cause responsible for cardiovascular diseases, and I found that cause to be chronic inflammation. As I was moving forward in my research and my clinic practice, I found that all chronic diseases have as the cause chronic inflammation, and this is caused by a wrong lifestyle. Let's have a look at some of the different manifestations of chronic inflammation. Firstly, obesity, which we are analyzed later. Secondly, type 2 diabetes, some types of cancer, cardiovascular diseases, hypertension, and some neurological diseases such as multiple sclerosis. There are other illnesses that have a genetic background which are activated when one has a poor lifestyle, such as Alzheimer's disease, autoimmune diseases, and other types of cancer. In view of the above-mentioned manifestation of chronic inflammation, I will now analyze the three different conditions of my patient along with their degree of acceptance and commitment upon being prescribed a change in lifestyle. Firstly, the person who suffered an acute disease and panicked. This means that chronic inflammation turns into a dangerous situation, like a hypertensive peak, a stroke, an acute myocardial infarction, ischemic cardiopathology, which requires revascularization, etc. This group of patients doesn't hesitate to change their lifestyle. But what is their degree of acceptance and commitment? 70% of them hesitate, 70% of them keep it up over an extended period of time, but 30% of them only practice the prescribed lifestyle change only during the time of the scare, which is between 3 and 6 months. The second group of people who are apparently healthy and are advised to continue being healthy, they need to know if the lifestyle they lead is correct, or if not, what alteration they should make. This group of patients is the one that adheres to the plan the most. The third group represents the majority of my patients. These are patients with manifestations of chronic inflammation, but they are accustomed to living with them. For example, obese people, diabetic, hypertensive, just to name a few. These patients are the ones who usually receive different types of medication, are told to go on a diet, lose weight, stop smoking, sleep well, and exercise. Their doctors also tell them to come back within 2 or 3 months, at least. This is the medical system in my country. The physician's advice generates despair and helplessness because the patient already knows he or she needs to lose weight, to stop smoking, to do exercise, to sleep well, and so on. They already know they must modify their lifestyle, but they feel alone and overwhelmed with all these indications they must follow, but don't know how to. But in the long run, what does the acceptance and commitment to the plan of change in lifestyle depend on? In this group of patients, mainly, it depends on the way the patient gets to the lifestyle center. In this group of patients who have chronic diseases as a consequence of the chronic inflammation, they come to the center in 2 different situations. Those who become aware of the situation and want to reverse it, and those who come under pressure because a close relative insisted on it. It is common that their family insists. They go to the doctor by saying, look at yourself, look at your belly. If you don't do something, you will die. Or they tell them, you have diabetes because you are overweight. If you don't take care, you will end up like your brother, obviously. You can imagine how his or her brother ended up. This group of patients goes to the clinic only to please the close relative. The level of acceptance and commitment of these groups depends on the conviction of the particular patient who wants to improve their health condition. However, the conviction needs to be genuine, to come from their inner self, not from their reasoning. Once the patient walks through our doors, he or she becomes our responsibility. And at that moment, we must use all our tools in order to convince those with a lower percentage of commitment to healthy lifestyle to stick with us, and help those who, due to our effort, have a higher percentage of adherence of the plan or of the program in the long run. Change in lifestyle is not easy. This is due to the fact that human nature tends to prefer whatever is easiest, believing that fast and cheap is best, instead of believing in a project and lifelong commitment. To help our patients change their lifestyle, we must understand them. We need to make them open up emotionally to us. Hence, putting ourselves in their shoes, understanding and helping them. In this way, we can get to know their strengths and weaknesses. On the other hand, this process takes time because the patient will do so only when he or she feels that they can trust us. And we have to gain this trust. In order to do so, I try to develop a feeling of empathy so that the patient doesn't feel it is a doctor-patient relationship, but a team relationship. I consider this the cornerstone of success. We are a team. The patient is the player and I am the coach. If the results are successful, that is to say, if we win the match, it is because both of us demonstrated our commitment. The coach gave the right instructions and the players complied with them. I schedule this face-to-face meeting with each member of my team weekly in my clinic. In this meeting, I evaluate the difficulties and achievements accomplished during the week, to point out mistakes, trying to solve them, and to praise and enhance their achievement. The patient must never be reprimanded for anything he or she hasn't achieved. We must accompany them throughout the process because this strengthens the relationship the most. It is my firm belief that true medicine, the one that ensures well-being or being well, is not made by any laboratory. It is a compound that should be supplied for life, and this is lifestyle medicine. Once I managed to create this genuine relationship, we start to work on modifying the lifestyle. This modification has to be gradual, not drastic, as any drastic change doesn't last long. To do so, we must get to know the kind of lifestyle the person leads. Taking this into consideration, along with the type of chronic disease the person has, will determine how I will proceed. Now, let's concentrate on obesity. As you all know, it is the main pandemic of the non-communicable diseases. It is called the illness of the 4 M's, which stand for metabolic, mechanical, mental, and monetary. Let's have a look at the different M's. Metabolic. It is an illness whose causes and consequences are metabolic. Its metabolic consequences are well known, but its metabolic causes which lead to obesity are not so. I will analyze the metabolic causes that lead to obesity. When a person has a bad lifestyle, their poor diet generates a general chronic inflammation determined by an excessive formation of arachidonic acid, which is the one of the most inflammatory biochemical substances in existence. As Barry Sear said, to avoid arachidonic acid flowing and bringing about organ injuries, the adipocyte, which is the fat cell, encapsulates it. By doing so, the average life of the adipocyte decreases. Therefore, it dies before. As the human body is so wise, when there is a strong evidence of the death of the adipocyte and the subsequent liberation of arachidonic acid, the adipocyte emits biochemical signs as a way of asking for help, so that new adipocytes are formed to encapsulate the arachidonic acid, which is liberated after the death of the first adipocyte, increasing the fat mass due to increase in adipocytes. This increase in the fat mass will remain as the formation of arachidonic acid continue due to poor diet and bad lifestyle. For this reason, fat formation has to be considered as a mechanism of protection of the whole body when there is an increase in the formation of arachidonic acid due to bad lifestyle. Once this fat is such that it generates obesity, metabolic diseases start to appear, such as diabetes. Mechanical. Obesity produces continuous stress on the joints, mainly at the level of the lumbar sacral spine, hips, and knees. Mental. There is a very close relationship between obesity, depression, and diminished self-esteem, as its reversal produces an increase in self-esteem. Monetary. It is well known that obesity in itself and its complications generate economic, personal, and social costs. All the things mentioned before can be avoided and reversed by changing lifestyle to achieve a good lifestyle. The fundamental cornerstone to do so are based on good nutrition, physical activity, quitting smoking, getting good sleep, and good hydration. We know that it's extremely difficult to make changes, to adopt and keep them, even when we rationally know that this is to achieve a state of well-being. I have already emphasized that the basis to achieve this goal is to create a team relationship and accompany the patient throughout the whole process. In the weekly visit to my clinic, we evaluate the results of the goals set for that week regarding the progress and the patient's change in lifestyle. They are given tools to correct and overcome difficulties. Achievements are shown positively, and new objectives are set for the following week. It is a long way. I would say it's a lifelong commitment to achieve a state of well-being through a good lifestyle. We have to do it firmly, knowing that there will be setbacks, and that it has to be done in a slow and progressive way. Let's remember that abrupt changes don't bring about good results in the long run. All progressive changes bring about adherence and success, which is what we are looking for. Regarding the physical activity, we do it in the promenade of Montevideo. I try it is done in our open air so that the patient is in contact with nature. I personally go with my patients and I do all the exercise that I prescribe. Obviously, the kind of exercise is different depending on each person. In this way, we perform the physical activity in group, but according to the patient's needs and capabilities, as you can see in this slide. The fact that it's a group activity boosts energy and motivation. In my opinion, this is the only way to strengthen the relationship of doctor-patient team and to achieve our goals. When the patients start to perceive that my effort and my commitment are genuine for them to maximize their lifestyle, it generates a stronger commitment. I can assure you that achieving this goal is perfectly possible. Attitude, motivation, and commitment are necessary. We also need to check that the goals are being achieved. Once again, I would like to say that I feel honored to have been invited and thankful for the opportunity to share my personal experience with all of you. Thank you very much.